Uh, Good evening. Good evening to everyone. I Indian Association for Veterinary Dermatology and Intas Health Dermatology webinar team welcomes each and every veterinarians who are attending this show. Thank you for your interest in this. And we know very well small ruminants play a major role in the economy of the poor country. So we have got a lot of economic loss due to parasitic and fungal diseases in small ruminants. So this particular thing is a very important thing for revenue of the farmers. So we thought we'll go for important topic, fixing this topic as today's webinar. With a great expert, we are having our own professor and head who is from Veterinary College, Dr. Vivek Kasralikar, who is HOD, head of the department, Bidar Veterinary College, Veterinary Clinical Complex, who is expert in this ruminants. So he will help us to identify the disease, how to go about, how to manage it, all those things he will do. So he is going to present in a great way. I welcome you, sir. And I also welcome our team, Intas knowledge partner, Dr. Nitin Patia, Dr. Dr. Ravindra Patel. I welcome all of you, sir. So I request our Dr. Nitin Patia to introduce our speaker. Thank you.
Thank you, sir. I hold short of words to introduce Dr. Vivek Kasralikar. Dr. Vivek Kasralikar is a renowned veterinarian, currently working as Professor and Head Department of Veterinary Clinical Complex, Veterinary College, Bidar, that is the headquarters for Karnataka University, Veterinary University. He is a renowned physician with PhD in medicine with total of 30 years of experience. Started his career as an assistant professor down in 1988, rose to associate, and is currently professor and head earlier of medicine, now of veterinary clinical complex. He has many presentations and papers and publications to his credit. He has several awards in both national and international conferences. He has been advisor to more than 10 MBSc students and advisory committee member for more than 30 of them. He has undertaken many ICR projects, 2 of the university funded projects, 5 university funded projects as co-coordinators, and also has undertaken number of training program and ASCA trainings. So we have pleasure in inviting Dr. Vivek Kasralikar for yet another insight into the small ruminant sector, especially dermatophytosis and mange. So over to Dr. Vivek for an elaborate insight into the topic.
Okay, so thank you very much, Dr. Nagarajan, for inviting me to speak on dermatophytosis and mange infection in small ruminants and giving me an opportunity for a part of Association for Veterinary Dermatology. And I also thankful to Dr. Nitin Bhatia, who is very keen in making the scientific knowledge sharing with the veterinarians of the country and abroad. So the topic now we will be talking about the dermatophytosis and mange infection in a small ruminant. So to start with, skin, though it looks, it is the outer coat of every human being and animal, it contributes to 12% of the adult body weight, which many of us may not be knowing, and it is the largest organ. And as a matter of fact, during the younger age, it contributes up to 24%. But as the size grows, it gets reduced to 12% of the adult body weight. And this is the only organ what is and endoderm, all the three layers of germinal layers, and that is how the skin is formed. And it has got so many functions. The first one is it acts as a physiological barrier, which you know, which will prevent the entry of any organisms or any foreign objects to enter into the body. That is the first regulation is also one of the important functions the skin carries out. It also acts as a storage organ. Then it is also a indicator of general health. By looking at the skin, one can say now many times we say, isn't it? You are looking pale. So pale appearance itself says that the person is not in good health, and even that can be seen on the animals also. So the pale appearance of the animal can be an indicative of a disease, ongoing process of the disease. So there is the first barrier which prevents the and so that the infection doesn't set in on the skin. And the most important another one function which is being carried out by the skin is vitamin D3 production. So under the when the skin is exposed to low intensity ultraviolet light, the vitamin D production starts, and this vitamin D production is very important in calcium regulation. So that is the one which actually vitamin D3 is responsible for calcium absorption. Many times nowadays, we also keep on telling to the student what is the importance of vitamin D3. In absence of vitamin D3, the calcium cannot be absorbed through the gut. So any amount of calcium, even if it is present in the diet, in absence of vitamin D3, the calcium cannot be absorbed. And that's how the hypocalcemic state can occur in the animal. So this vitamin D3 production occurs in the skin. So skin plays a very important role in the production of vitamin D3, an important hormone, what we can call that. Next, please. Going to the actual design, I wanted to impress upon the histology of skin, and it very clearly you can see there are three important layers, and this you should understand because the skin infections which we are going to look into in today's webinar, they will be restricted. Some of the infections they are restricted only in the epidermal layer, whereas some of the mange-like infections they can go deep into the dermis also. So you can see here the topmost layer what we call as epidermis, which is a smaller layer, and this is the one where the keratin is formed, and that basically in fungal infections this is the important layer where the fungi they will be thriving on it, because keratin is the protein on which the fungi survive. Okay, so not only hairs, the epidermal dead cells are also one of the. Now we'll move to the important first topic is dermatomycosis and dermatophytosis. Now, when I was undergraduate student that time, we used to miss our professor of microbiology. He used to say that dermatophytosis is restricted to the infection caused by trichophyton species, and dermatomycosis is restricted. The term is restricted to the infection caused by the microsporum. So these are the two important organisms which can cause dermatophytosis and dermatomycosis in case of animals, and that is what we are going to look into. So this invasion of the cutaneous keratinized epithelial layers by these fungi, and along with not only the epithelial cells, they also attack the hairs on the skin, and that's how they thrive and they spread the infection. So among Trichophyton, two important species are there. One is Trichophyton verrucosum, which is very prominent, and the other one Trichophyton metagrophytes. This is also another one which is commonly encountered. So if you look at the the susceptibility of different species of animal to these two fungi, it has been observed that the trichophyton is very commonly encountered in ruminants, whereas the microsporum is more restricted or more commonly encountered in dogs and cats. Okay, and in human beings also. Okay, so Trichophyton verrucosum and Trichophyton mentagrophyte. These are the two important species of Trichophyton which are commonly encountered in small ruminants. and two other species of Microsporum, Microsporum gypsum and Microsporum canis. These are the two Microsporum species which can cause dermatitis in case of small ruminants. Next slide, please. We'll move to the next slide. So if you look at the epidemiology and pathogenesis of dermatophytosis and dermatomycosis, the spread of the infection is mainly through the direct contact. So that's why we call it as a contagious disease. Okay, so not that contagious as that of mange, but direct contact with the infectious animal helps in spreading of the infection from infected to the healthy animal. Okay, apart from that, indirect contact through the fomites, where the animal they routinely share their space, that is also a source of infection, and that's why common space beddings, grooming kits, these are also important source of infection, and that's how the fungus from one part to other part it gets spread. One more important thing is about zoonotic importance. It can infect the persons who are directly in contact with the infected animal, and that's why one should be very careful. And apart from that, these fungal infections, they are very tenacious. They are not that easy to be controlled, or that not very difficult to be treated. That's why all the including veterinarians, they should take due care in handling the cases of dermatophytosis. Then it has been observed that the incidence is very high during the winter, and the reason given is because of the dry weather. So dry weather makes the epidermal layer more dry, and because of that, it gives a room for the fungal spores to invade and then cause the infection. Then the incidence is also high in immunocompromised animals. So that's why young kids and pregnant animals, they are more commonly affected with dermatophytosis. Next slide, please. So what we have to understand in pathogenesis, fungus, they mainly thrive on the keratinized layer, that is stratum corneum and hair fibers. So keratin is the food for these fungi, and that's how they eat and then survive and then keep on propagating under the skin layers. Okay, and they also cause autolysis and of the hair fibers, and that's why alopecia is a very prominent symptom of dermatophytosis in case of animal. And then you will be, when we will be, I will be showing you some of the pictures that you will understand and you will identify that these dermatophytosis lesions, they actually appear ring-like. Okay, and this ring keeps on increasing in size because these fungi, they progress centrifugally. What is the reason for that? The main reason for this is the aerobic nature of the fungus. So fungus, they need not only the keratin for their growth, but also require oxygen. And because of the oxygen, what happens is when the infection is there, keratinized dead cells, they will be present over the skin and then form a thick scab, and then oxygen supply to that particular area goes down, and that's why these fungi, they move towards the periphery, and they need oxygen for their growth, and that's how the fungi, they grow towards the periphery, and that's how the skin keeps on, the ring of like lesion in case of dermatophytosis keeps on increasing in size. Okay, then the skin pH also plays an important role, and this has been a well established fact in case of human, because the study has indicated that the alkaline pH is more favorable, and that's why the fungal infections, they are more common before puberty. Younger kids, they are more susceptible to the dermatomycosis and dermatophytosis than the adult one, because acidic pH which is there, and it is controlled by the certain hormones, and this acidic pH in case of adults, it itself acts as a fungistatic and doesn't allow the fungi to grow in presence of sebum, which is rich in fatty acids. So fatty acids as well as the sebum, skin secretions, and the acidic pH does not allow the fungi to grow and propagate, and that's why the lesions and the infection rate is much less in case of adults when compared to the young ones. We'll go to the next slide. So what are the clinical findings of dermatophytosis? Typical grayish white raised circular patches on the skin. Okay, and then owner will always tell that it started with a small spot, and now the size of this spot is increasing in a circular fashion. And you also can very well appreciate that raised. And in case if you try to scratch out, you can find a white dust-like material, which is nothing but the dead keratinized layer. Okay, and if you just try to remove it, you can see the underneath the skin is there, and you can feel that the lesion is extending towards the periphery. Alopecia, because these fungi, they attack the hair fibers, so that's why hair loss is very prominent. So alopecia over and the side of the lesion is very much prominent. The lesions are more commonly found on neck, head, perineum. In few animals, it could be a generalized form. So when we will be discussing about the treatment of dermatophytosis, we have to categorize the case, whether it is a localized infection, whether it is a generalized infection, because the treatment protocol differs depending upon the type of presentation, whether it is a localized form or generalized form. And very distinctly, the itching is not very prominent. The itching in other skin infections, especially in mange, it is very intense. Here, in case of dermatophytosis, the itching is not very prominent. Itching is there, but that is not the prominent feature of dermatitis caused by fungi, that is dermatophytosis. Now here you see, you can very well identify, you can see here a typical circular lesion. See here, so much of extended lesion is there. There is a complete loss, baldy skin you can see, okay, and it is covered with a white dust-like material, which is nothing but the dead keratinized cells, okay. Over here also you can see one lesion. Here also you can see one lesion. So all these circular lesions, and they progress. Okay, initially it could be a localized one. Over a period of time, it can entirely cover the body, and there could be a generalized type of dermatophytosis. Okay, so this is a very distinct picture I wanted to share with all the audience, and you can very well appreciate how the lesions of dermatophytosis they appear on the skin. Next slide, I will be telling you how the generalized and a more severe form of dermatophytosis. Here you can see here so much of thick skinning. We call it as lichenification. This is actually a case of mixed infection. It is having dermatophytes also. It is also complicated with the sarcoptic mange. So there is a mixed infection. So in sarcoptic mange, the most distinct feature is lichenification. You can see the skin folds, okay, and these are the grooves which gives room for the bacterial growth population and gets complicated. Okay, so here you can see how much of thick keratinization has taken place. Okay, on the layers. Next, please. See here, this is one photograph I am sharing. Here you can see how the lesions are. Okay, the entire head is covered with dermatophytosis as well as a sarcoptic mange extending up to neck. Here also you can see the lower limbs. Okay, so probably because it is a soil-borne fungi, so they propagate on the lower limbs also. Here you can see lower limb is also affected in this sheep. So much of this you can call it as generalized. Of course, the remaining part is the other side is very severely affected. You can see the entire body of the organ, body of the sheep, and how debilitated the animal is. So because it is a very pathetic type of the dermatological condition, which makes the animal become anorectic. Also, loss of condition also will be there in chronic dermatophytosis. Next, please. Then diagnosis. How you are going to diagnose a case of dermatophytosis? Okay, so the lesions which are there on the body, they themselves are indicative that it is definitely a case of dermatophytosis. So you think whitish, grayish white raised lesions which keeps on increasing in size. Moreover, they are circular in nature. So that itself can say that it is a dermatophytosis. Alopecia is very prominent, but itching is not that prominent in case of this fungal infection. But the confirmation is it can be done by two ways. One is the skin scraping examination, and the other one is wood slam. Most previously we used to say that wood slam was a very handy tool for most of the field veterinarians because it doesn't require anything. It is a specialized type of lamp which has got a UV light source, and if you focus it on the lesion, the fungal spores, they have got a typical blue, greenish blue fluorescence. I will be sharing a photograph of that. Probably it is not there in this PDF file, but anyway. So this wood lamp, it is a simplest diagnostic tool, but many times most of the veterinarians, they are telling that sometimes the fluorescence is not visible, though the what we can call it as false negative case, means the dermatophytosis is there, but exposure to the wood lamp doesn't give the greenish blue fluorescence from the lesion, which is a very distinct feature. Okay, so skin scraping examination is the confirmation. So what you have to do is you have to moisten the skin with the liquid paraffin, and then scrap the lesion, and then digest with 10 to 20% sodium or potassium hydroxide. So once you digest it, digestion is done by boiling it. So skin scraping has to be added in about 2 to 3 ml of potassium or sodium 10 to 20% solution, and then you have to boil it. So once you boil it, then centrifuge it and collect the sediment. And this sediment has to be microscopically investigated under 10x, 40x, and then you can very well identify the fungal spores available in the skin lesions. Okay. Apart from that, plucking of hairs from the periphery can also be a useful tool. And this plucked hairs, and they should be directly focused under the microscope, and you can see the arrangement of spores, because this arrangement of spores around the hairs can be a differentiating diagnostic tool for means whether it is a trichophyton or microsporum, which I will be telling you, and I will be sharing with you in the next few slides. Another important thing is skin scraping examination will be telling you the appearance of the fungal spores. So here you can see the trichophyton, a typical linear. Okay, they will be appearing in stack. So this is a hair fiber, and there is a clear cut, attachment of the spores along with the hair shaft. Okay, here also you can see. Yeah. So this is actually stained with lactophenol blue. A direct scraping, you can stain it with the lactophenol blue, and you can see the linear arrangement. So this linear arrangement is very, very important. Okay, so that says that it is a trichophyton. Mosaic pattern of spores in the skin scraping, it is an indication of microsporum species. Okay, so if they are scattered, they are not. And then apart from that, inside and outside hair, if you focus the infected hair under microscope, if the spores they are there inside the hair shaft, it is microsporum. They call it as inside out deposition of spores, which is the characteristic feature of microsporum. Whereas trichophyton, it is only ectothrix, means they are available only outside the shaft of the hair. Okay, so that is preliminary. Next slide we will be seeing more. So this is how, if you focus them in a high power, maybe on 40x or 100x, you can see stacks of pearls. You see here how beautifully they are arranged. So this is a typical appearance of trichophyton spores. So they are in linear form. Okay, so they stack one above the other, and then sometimes you can see the hair shaft also. So here, this typical arrangement of the fungal spores, it itself is an indication that it is a trichophyton species. Okay. Next slide, please. So here I was telling you. Okay. So here two images I am sharing with you. You can see the appearance of the spores. So this is the hair shaft, complete hair shaft, and you can see here the whole hair shaft is inside the hair shaft. The spores are scattered. So this is microsporum. Okay. The other picture you see the hair shaft, inside the hair shaft you don't find much of the spores. Much of the spores they are attached to the outside the hair shaft. So this is trichophyton. Okay, so that's why we say that it's here at the periphery of the lesion should be plucked, and a microscopic examination should be done, and then arrangement of spores that will be indicating whether it is a microsporum species or trichophyton species. But this is all qualitative type of testing. The confirmation only can be seen by the appearance of the microconidia, that is the sexual form of the spores of these two species. So in next few slides, we will be trying to see how they appear under the microscope when you culture them. You see here the scraping has to be cultured in Sabrot's dextrose medium, and then you have to keep it for about 3 weeks time. and sometimes they say that chloramphenicol can be enriched to this so that the other fungi and other organisms they don't invade, because you need to culture them for at least for 3 to 4 weeks. And you can see a small, the culture, whatever you get, if you take a small portion of it and stain with lactophenol blue, even Chicago sky blue stain also can be used, but the lactophenol blue is the most commonly used stain for fungal spores. So this they call it as spindle shaped microconidia, and they are typically indicative that it is microspore. Okay, so this is a spindle shaped microconidia. They are indicative of microspore. Okay, in next slide we will be discussing about the trichophyton. You see here, earlier slide please. Yeah, this they call it as pencil shaped microconidia. So this pencil shaped microconidia, they are the typical feature of trichophyton. So once you culture this skin scrapings and the sabrods and dextrose media, after 3 to 4 weeks you will get the growth. A small portion of this growth can be taken on a slide and it can be stained with lactophenol blue, and you can very easily identify whether it is a trichophyton or whether it is a microsporum. Microsporum is having a spindle-shaped microconidia. Trichophyton, they are having a pencil-like appearance of microconidia. So this is a distinct and clear-cut differentiation of whether it is a dermatophytosis or dermatomycosis. Then in next slide, I'll be showing you this is the wood slab. I was just going through the net. Variety of wood slabs they are available. You can see here it has got a window through which the skin lesion can be seen, and then underneath of this wood slab, and underneath that inside, the UV light will be there. Okay, so once you put on this button, the UV light will be focused on the lesion, and this is a shield. UV protective shield is there. Through this you can just visualize the lesion. So if the lesion is positive for either trichophyton or microsporum, these fungal spores, they will have a fluorescence, bluish green fluorescence, and this can be very easily identified through this window. Okay, this wood slab. So market, I was just checking it, from 1,000 rupees to 26,000 rupees the wood slab, maybe depending upon the type of UV bulb what they are using, and then the company name. The wood slab is available, and in human practitioners, mycologists, they also very much depend on this wood slab, and it is the most easiest way by which we can say whether the infective lesion is caused by dermatophytosis and dermatomycosis. Okay, so this is how. Only thing is you have to take care, because it is a UV light. You have to visualize the lesion through this window only, because we know that the UV lamp is highly dangerous to your retina and it can damage your retina. So direct visualization of UV lamp should not be done, and that's how this protective mechanism has been followed in manufacturing this wood slab. So inside this, the UV lamp is there, which is not visible. Okay, and the UV light will be focused on the skin, and then through this window you will be able to see the lesion, and from the lesion, if you get a bluish green type of fluorescence light emitting, it is 100% positive for wood slab, for the dermatophytosis. Okay, that's how it becomes a very handy tool for dermatologists to say whether it's fungal infection or not. Coming to the next slide. Treatment. So as I told you, we have to see the two proportions of this treatment protocol. One we call it as standard protocol, and the other one is called as practical one. So first of all, in the initial stage, you have to say whether the infection is localized or generalized. If it is localized, it becomes an easy job for you, because it is a small part of the body which is affected with the fungal lesions. And topical antifungal creams, I was just checking the Intas product protocol. So there I could see the Oxito. Oxito is a herbal medicament preparation. Apart from that, other antifungal creams are also there. So these topical antifungal creams, if they are applied to the lesion, most of the localized infection can be controlled. Okay. So these most of the antifungal creams which are available in the market, the important contents are miconazole, which is an antifungal agent. Then one antibiotic is there, and steroid. Steroid helps in reducing the inflammation at the site of dermatophytosis. And apart from that, it also helps in thinning the keratinized layer. So that's why steroid is always a part of antifungal, topical antifungal creams. So combination of antibiotic, miconazole, and steroid. And there are variety of steroids which are being used with miconazole. Hydrocortisone is the first preference. Apart from that, nowadays clobetasol is also there. More other steroid preparations are also there, which are having a shorter, half life, so that they do not cause a systemic steroid overload. So that's why the most of the pharmaceutical companies, they are looking for a newer type of steroids which will not enter into the system and cause a serious immunosuppression. All of us, we know that steroids, they cause a lot of immunosuppression. So long term treatment is not advised with the steroid containing antifungal creams. But localized infection can very easily be treated with these topical antifungal creams. And I was telling you, the topical herbal medicament ointments, the market is so many preparations are available. I was sharing with you the Voxeto is we have tried at our hospital. We could able to see a good response to this Voxeto. It is a combination of several herbs, and the most important one is the neem extract is there. Then long extract is there, that is there. So these are some of the components are there in herbal medicament, which act as antifungal agents, and then they can reduce the dermatophytosis. But when the generalized type of dermatophytosis is there, then there is no other go. So you have to go for antifungal, systemic antifungal treatment, or even the sodium iodide or potassium iodide. So sodium iodide, they say it has been advised that 1 gram per kg body weight as 10% solution can be given intravenously in the treatment of dermatophytosis, or orally potassium iodide about 1 gram for about 5 to 7 days can be given. Sodium iodide, it depends. One single injection may be effective, or sometimes you may have to repeat once in or twice in a week for at least 2 to 3 times. Then antifungal antibiotics and other preparations are there. The front leader is the griseofulvin, which it can be given at the rate of 10 milligram per kg body weight. Ketoconazole was launched way back, and that is also was found to be very effective in generalized dermatophytosis. Itraconazole is rightly presently being preferred as the first line treatment for generalized dermatophytosis, and it can be given at the rate of 3 milligram per kg body weight and oral dose. But the most important side effect of these antifungal agents is the hepatotoxicity, and because of that, you have to think twice, or you have to keep it in mind that during the course of treatment, you have to take care of the liver function, and you have to keep on monitoring the liver function. Okay, and then supplementation of liver tonics can also be a supportive treatment for the dermatophytosis when you are keeping the animal on antifungal drugs. And if you go through the literature, these antifungals, they have to be given for about 3 to 4 weeks, sometimes 6 weeks also, in case of tenacious type of dermatophytosis. Okay, and that causes a lot of hepatotoxicity in case of the affected animals. But if you combine the treatment with improving the liver function drug, you will definitely get a success in that. Then this is about the standard book protocol for the treatment of dermatophytosis. Then in case of large scale infection is there, then we may have to go for the practical protocol, which I'll be talking in the next slide. Yeah, practical approach. So here the topical application, the whole body has to be painted with certain solutions. And these, what are the solutions which can be handy for the control of dermatophytosis? Even painting of the lesions, wherever the lesions are there, povidone iodine can also be effective. Wheatfield ointment, since ages together people are using, which is a combination of salicylic acid and benzoic acid, is also effective in treating the generalized type of fungal infection. 3% thiabendazole ointment is also effective in case of dermatophytosis. And then in larger farms, you can think of animal dips. A 3x6 a small tank can be prepared, and following solutions can be used through which the animal can pass. And then when the animal passes through this medicated water, so automatically, or antiseptic or antifungal solutions, automatically the effect is exerted, and the 0.5% sodium hypochlorite is being very routinely used. And then I was telling you, I was discussing in other presentations also. Some of the veterinarians, they are very innovative, and I am a part of this allopathy ruminant WhatsApp group, where a lot of the allopathic veterinarians, they are involved, and one among them is Dr. Anil Virani, and I could able to know from him that he is using since a very long time, and all of you can also give a thinking for this. What he says is the castor oil, which is available in the market, that can be boiled, okay, and it should be saturated with sublimed sulfur. Means you have to keep a castor oil in a on a burner, and then once it starts boiling, you can cap. It becomes this little bit of sulfur powder should remain at the bottom. So that says that it has reached to the saturation level, and this castor oil can be stored in a glass bottle, and this can be applied to the lesion. Okay, and he says that it gives a wonderful result in case of dermatophytosis. Okay, so we can call it as medicated castor oil. Like it becomes brown colored. Okay, castor oil is transparent or semi-transparent. Once you add sulfur, this can be kept in your hospital, and whenever you suspect that is the dermatophytosis, this then mind what effect, what could be the medical logic in that. So what I could able to come to conclusion that probably this painting of oil, it makes the condition, it prevents the oxygen supply to the underlying fungi, and because of that, probably it gives a good antifungal effect, and that's how the animal gets cured of dermatophytosis. Then what are the preventive and control strategies for dermatophytosis or dermatomycosis? The most important one is the cleanliness, because these are the saprophytic, or the ground fungi, which are commonly found in soil, and they get on the animal, and if they get chance, they get overpopulated, and they set up the infection. So cleanliness and hygiene in the enclosures is very important. Moisture and wetness is the very positive factor for the fungal growth that should be avoided, so that the fungal infection doesn't occur in the animals. Then spraying of any of these following disinfectants in the premises can also, as a fungistatic type of method. 5% phenol is there, lime sulfur is there, formalin, all 5% sodium hypochlorite. They can be spread on the ground so that it will act as a fungistatic solutions. Then apart from that, you have to pay a lot of attention on quality nutrition, because malnutrition and this dermatophytosis, they go hand in hand. So you have to improve the plane of nutrition in the affected as well as the other flock mates. And the topic is open for the younger scientists. Already in USA, people have worked on this. Smith and Griffith in 1995, they have tried the attenuated vaccine for the ringworm, and it is about 80 to 85% effective as a preventive control strategy. So in India, we don't have anything of that sort, but pharmaceutical companies, they always can keep an eye on this, and they can think, and the younger researchers can always think of attempting a vaccine on this attenuated fungal spores. Then we'll go to the next part of my presentation, that is mange. So mange is caused by so many mites, but the most important one, and you can say that they are in the ascending disorder. Sarcoptic mange, it forms the top of the mange in case of farm animals, followed by Sauroptes, then Coreoptes, and Demodex. Okay, and all of them, they are important. And in next slide, I will be telling you how what are the differentiating features of these different types of mange. Okay, so we'll be discussing in all the 4 types of mange in case of small ruminants. Next slide, please. Yeah, this I could able to get a picture on the internet, the farmhealthonline.com. So here you can see, the color, chart is there, and then by identifying the type of lesion, you can say whether it is a Soroptis mange, whether it is a sarcoptic mange, or whether it is a choreoptic mange. Okay, so here you can see scab mite on the head. Okay. What happens to what about the choreoptic mange? Choreoptic mange is always called as ear mange or tail mange or the leg mange. Here you can see the choreoptic mange. The lesions are more pronounced on the legs, lower legs, and at the base of the tail. Okay. Whereas the demodex, it starts with face and then goes laterally. Even sarcoptis also, head is the most prominent one. The other slide I have shown you how sarcoptic mange can appear in case of sheep. It starts with the face and then goes on the lateral part of the body. So both the flanks can be affected in case of sarcoptic mange. Okay. Next slide, please. So here I have tried to give the differentiation. So you can see all 4 types of mites have been described here. Sarcoptic mange is caused by Sarcoptes scabite. This is the burrowing mite. Mind it. Other 2, demodex is deeply seated. Let us not worry about that. Among these 3, the sarcoptics is burrowing. It keeps on, going deep into the dermis. Okay, and the Soroptis and Choreoptis, they are non-burrowing like. And how to identify? I'll be showing you the in the diagnosis how to identify the sarcoptic. So they are identified by the stumpy legs. The legs, they do not go out of the periphery of the body. That's why one of our professor used to say S stands for sarcoptes, and this S stands for stumpy legs. Stumpy legs. Soroptis caniculi, they are non-burrowing. They are called as, this P stands for protruded leg. Soroptis cuniculi. The lesions are more restricted to the ears. Okay, legs and ears. Okay. Then the Choreoptis semi-protruded, slightly protruded. In between, you can say between the sarcoptic mite and the soroptic mite. So they are also non-burrowing, and the lesions are more restricted to the base of the tail and lower limbs. Here, the head and ears, they are the major organs which are affected with Soroptis. Okay, whereas sarcoptis can be generalized. Okay, the whole body can be, and amongst all mange, the sarcoptic mange is more dangerous because it can spread to the animal in very rapidly, and it can cause a generalized form. And secondary bacterial invasion is very common, and that's why lichenification, thickening of the skin, is very distinct. I told you in the earlier slide how the lichenification appears, and this lichenified skin cracks, and that gives room for the secondary bacterial invasion. And all this sarcoptic mange, soroptic mange, choreoptic mange, the intense pruritus is the distinct feature. The rubbing of the body part is very, and sometimes in the even choreoptic mange, they say that the itching is so prominent that the animal gets self-inflicted injury. It keeps on biting to the body where the lesions are there. Okay, and frequent head shaking, because the ear is affected. Inside the ear, the mites are there. Frequent head shaking in a flock could be one of the important features of soroptic mange. Okay, in a flock, if you find the constant head shaking is there in few animals, you check them thoroughly, you will find that they are positive for soroptic. Demodex is a very different type of mite. It is very deep seated mite. It goes into the hair follicles and sebaceous gland, and the demodectic mange in case of dogs and cat is little different. They call it as red mange. Here it is a follicular mange, and most common feature is the formation of nodules on the body rather than other things what you find in other type of mange. So nodules are there on the body, and if you squeeze these nodules, a thick toothpaste-like pus comes out of that. Okay, and this is a very distinct feature of demodex mite. So demodex ovis and demodex capri. Choreoptic mange is caused by Choreoptis capri. Soroptic mange is caused by Soroptis cuniculi. Sarcoptic mange is caused by Sarcoptes cari. So this is all about the clinical features, then the site of lesions where they are restricted, description of the mites which can be by which they can be identified. In next slide, we will be going for the next slide, please. Yeah, here diagnosis. How you are going to diagnose a case of mange in case of small ruminants. Basically, the clinical findings in the first slide itself, I showed you the demarcation of lesion, restriction of lesion on the certain parts of the body can say that whether it is sauroptic mange, whether it is chorioptic mange, whether it is sarcoptic mange, or whether it is a dermatophytic mange. Okay, but the best way of identifying the mange, that means the mite involved in the mange, is the deep skin scraping. Okay, so as I told you, this type of burrowing or non-burrowing, but they are little deeper in the skin tissues. So that's why you have to take the deeper skin scraping. So superficial skin scraping, sometimes they will be negative also. Okay, but that's why you have to take deep skin scraping. Okay, and this deep skin scraping you have to process as that of fungal dermatitis. You have to put it into about 5 to 7 ml of 10 to 20% sodium hydroxide, boil it, and then centrifuge and take a sediment and observe under microscope. Here you can see, I was telling you the sarcoptic mange. You see here, the legs are very short and they are attached to the periphery of the body, round in structure. So they called as stumpy legs. Okay, and stumpy legs they are very characteristic of sarcoptic. And if you look at these two, they are like slightly elongated. The legs are protruded, slightly protruded in case of chorioptic mange, whereas a big protrusion is there from the body. Okay, some of them they are almost half of the body length. Okay, so this is a sauroptic mange, Sauroptes cuniculi. This is chorioptic mange, Chorioptes capri. Okay, and here you can see this is a very distinct type of mite. They call it a cigar-shaped mite. Okay, very long, elongated. Okay, and here you can see the legs, and this is a very distinct feature of dermatophytosis. Okay, so this is a demodex mite. Okay. Then coming down to the next slide, we will be discussing about the treatment protocol. So treatment, there are so many avenues are there which can be tried, but I am talking about the most effective way of treating the mange in case of small ruminants, and you have to depend upon microcyclic lactones, ivermectins, and there are about 4 macrocyclic lactones are available. Ivermectin is there, doramectin is there, piperidomectin is there, moxidectin is there. So the dose ranges between 200 to 400 microgram per kg body weight subcutaneously. Doramectin can be given by the intramuscular route. Okay, so people have tried 200 microgram, 400 microgram per kg is a more effective dose of ivermectin. In treatment of dermatophytosis protocol in case of dogs and cats is little different. Please, earlier slide, please. Dr. Amanjot, yeah. So ivermectin is given for about 4 weeks, 6 weeks daily on daily basis. So what as our practical experience in small ruminants, 400 microgram per kg body weight by subcutaneous or intramuscular route depending upon the type of ivermectin, and it can be repeated once in 15 days. Keep the skin scraping investigation, and if still you are finding, you can continue this 15 days protocol for about once in 2 weeks for about 3 to 4 times. In 90% of the cases, by 14th or 15th day, most of the cases become negative. If you are still finding positive, a second dose can be repeated after 14 to 20 days. Okay, so doramectin, they say that it is a longer duration; it stays there in the body for a longer period of time. So doramectin can give a protective titer for about 3 weeks, 4 weeks like that. But sometimes in severe infections, our ivermectin needs to be repeated after 15 days. Then moxidectin nowadays is available on 4-on applications also. Okay? Then flumethrin is there, that is also available as 4-on application. I was just going through the product protocol of Intas, and I could see the Flumitas is available 4-on application like. So that can be. It is actually a very easy way of taking care of mange infection. Okay, so pour on, they are sufficient quantity is there, and then they say that how much to be applied. It is very much readable, and if you explain to the owner, so that can be treated. But only problem is this pour on applications, they are individualized, like in a flock basis. If you want to treat mange, you have to go by for the parental ivermectin injections. Okay, so like that, so many preparations are available. Moxidectin is also available. Then the flumethrin is also available in the form of flumitas, and this can be applied over the body, and they are also equally effective in controlling mange infection in case of small ruminants. Next, please. In large farms, if the infection rate or the incidence is on very high side, you can again think of that dips, medicated dips. So in a pond, you can prepare a medicated solution, and then you can make the animal to walk through that, so that the whole body gets painted with this medicated solution. And following are the solutions which can be used: 0.01% diazinon, 0.06% flumethrin, 0.1% chromophos, 0.05% amitraz, 0.05% pen. Okay, but the only problem here is you have to shear the sheep, especially, and in case of goats also, you can do little bit of trimming of hair, so that the medicated solution reaches to the it comes in contact with the skin and it remains there. And apart from that, you should see that the head is raised for a period of time. Okay, so that the animal doesn't, while walking through the dips, plunge dips, it doesn't consume the because all of them, they are having a high toxicity levels. So if the animal drinks this solution, can end up into a poisoning like syndrome. So that's why that care you have to take. But very effectively, if you go through the internet, you will find so many African nations where the sheep farming is very routinely being followed, and normally goat farming is also there. So they make routine this solution. The animals are passed through this, so that the tick as well as the mange infection doesn't become a generalized problem in a flock. So these are the solutions which can be routinely used for the treatment of mange infection in case of small ruminants. Apart from that, supportive treatment plays a very important role in early recovery, which emphasizes on good plane of nutrition, then 3 to 5 days of antibiotic, non-steroidal anti-inflammatory drugs, as well as antihistamines in severe cases. Then Intas pharmaceutical, always they are innovative in nature, and so many products they are marketing. Even people have tried this mint shot also. In some of the mint shot, of course, they have taken out of the market, but it was a very good preparation, proper preparation. And we have also seen in few animals in where dermatitis was undifferentiated, and many animals, they responded very well as a supportive treatment with mint shot. So basically, you have to keep it in mind: vitamin A, vitamin E, selenium, copper, they play a very important role in skin health. So any preparation which is rich in this can be given parentally, or mineral mixtures can be given to the affected animal for rapid recovery. Okay. So this is what I just wanted to discuss with all the participants in today's webinar. And I am very much thankful to Dr. Nagarajan, the president of Association for Dermatology. He has opened a new chapter, and I have undergone 3 trainings in Chennai, and under him I could able to learn so many things. He is a very distinguished veterinarian, especially in veterinary ophthalmology, and he has taken an initiative in starting an association for veterinary dermatology, and definitely his efforts will be recognized globally, because he is trying at a global level in getting a recognition. I wish him all the success in.
Thank you very much, Dr. Vivek, for your good presentation on small ruminants, mange, and dermatophytosis. Thank you very much. So as doctor was telling, the very important thing in dermatomycosis treatment is prevention.
Sir.
Prevention mainly, as he was telling, it is easily available with sodium hypochlorite is easily available for all the diseases, including corona and everything. We are using, even for the parvo, we are using this hypochlorite. So it is readily available in the market. It is very, very easy to use that. So that we have to be very seriously, we have to advise the owner to go for it. That is a very, very important role for veterinarians to insist that, so that it can be prevented by spreading to others. That is very, very important. And enilconazole also has been used, but this is very simple and easily available, so we can very well use that. And he has given a lot of list of drugs to be used for both mange and this thing. And he was very good in presenting that, explaining about the distribution of mange in case of sheep and goat. So it is very nice. So everyone might have appreciated that, and they have got good understanding of that distribution. So I thank you, sir, for your good presentation. And anything?
Thank you.
Yeah.
Sir, we have a few questions. So
Yeah, please.
Sir.
Vivek sir, I think we lost you. So Nagaraj sir took it over. So if you want to say a few words, you can, and then we'll come to the question answers.
No, that's it. We'll go to question answer. Sorry for the, the net connectivity is nobody's. I've tried my level best to see
because
that.
It is either you are either, so it will be like that. It is something inner part, interior.
But I hope we could able to connect it in the later part of my presentation. So thank you very much for patient follow up, Dr. Nitin.
Sir, we had a nice insight into both the conditions. So thank you for the same. We have a few questions from the audience.
Sir.
Number one is why pH is alkaline in youngs and how does it change to acidic in adults? Any ideas on that and any studies on animals in that?
Yeah, in human it has been well studied. They say that the hormonal change at the puberty, the hormonal change automatically it has got a direct bearing on the skin pH. So that's why below puberty, the young ones, they have got a little bit of alkaline pH, and that's why in human young kids the infection rate is much higher. That's what the documentation is there. I was just trying to share it. We have to find out in animals, and definitely it will have some, if you take an attempt, we'll be able to point out what may be the reason. Maybe hormones. What I mean to say, hormones are basically responsible for this change in pH.
Right, sir. The next question is from Dr. Babu. He says, what about Kiskin, sir? So I think you've already mentioned about the molecule. So very well Kiskin can be used.
Kiskin is a most dependable type of preparation by Intas, and it is very frequently being used, and it is a combination, again, antifungal as well as antibiotic as well as steroid.
So the next question is, could you throw some light on the pinna-pedal reflex as a diagnostic for dermatophytosis, if it is so?
Pinna-pedal reflex dermatophytosis. Nagarajan sir, you can. I think it's more commonly
even for sarcoptics, it is not a pathognomonic sign.
Yeah.
So they are going to create a itching by squeezing the tip of the ear. That particular disease will give more presentation, like it will be there for more than 5 minutes, that scratching. So that is the intensity of the scratching will be more. So from that we are identifying it as a sarcoptics. But any chronic skin disease will have itching whenever you are going to give pinna-pedal reflex. If you initiate, it will have itching, but we cannot say all as a sarcoptic. But in sarcoptic, the intensity will be very much appreciated. So that is the difference.
So the last question is, you talked about dermatophytosis and said about the margin taking and where the fungus is the highest. So could you throw some light on mange, how to get better samples of mange, which lesion part to be taken? Sir?
So I think his connection is not there.
Please repeat. Yeah.
Sir, you have talked about fungals. You have said that marginal scrapings will be better. So
Yes.
could you throw some light on the lesions of mange and how we can have better sampling and better outcomes?
Yeah. In mange also, mange also only deep scraping is the first priority. Apart from that, you have to see how the lesion is progressing. Okay. The fresh lesion will yield more results than the older lesions. You can see the progression of lesion. So wherever you can see the fresh type of progression is there, at that time, at that point, if you scrap more, you are likely to yield more mites than the center of the lesion.
Sir, last question. What is the role of Placentrix ointment in dermal lesions?
Placentrix, it is a non-specific immunomodulator. Non-specific immunomodulator. Milk proteins, Placentrix. Placentrix is nothing but a placental extract. So all these things have been tried in veterinary practice, and they say that it is a non-specific immunomodulator.
I think the Dr. Vivek has well answered the question. Placentrix is something like E. coli LPS for uterine infections, oyster shell for uterine infections, and similarly Placentrix. It is a placenta extract of humans and does help you in healing of the wounds by triggering a localized irritation and helping you out for better treatment. I think, sir, with that, we come to the end of the session. It was a nice insight into yet another important area of small ruminant dermatophytosis and mange. Sir, we thank you on behalf of AVD, Dr. Nagraj and Intas for taking us into a insight into the session and giving us newer insights into it.
Thank you, sir. Thank you.
Thank you, sir.
Thank you.
And we thank the entire audience for being there, being a part, supporting AVD and Intas always. Thank you to all.
Yes.